So in this video we start off with the invasive ventilator. In previous video we show what is mode, what is invasive ventilator, what is non-invasive ventilator. In the non-invasive ventilator there are two types, that is negative pressure type and the positive pressure type. So in invasive ventilator there are total two modes, that is volume mode and second one is pressure mode. So in volume mode, total four types is there: CMV mode, assistant control mode, IMV mode, and SIMV mode. In pressure modes, there are two types, that is PCV mode and PSV mode. So first we talk about the volume modes, that is CMV. That means continuous mandatory volume. Okay, then AC mode, that is assistant control mode. Then IMV, that is intermittent mandatory ventilation. So the mandatory, that means control. Mandatory means control. Then we talk about the SIMV mode, that is synchronized intermittent mandatory ventilation. Generally it is used with PSV, that is PSV. Okay, so that is known as the combination of the mode. So here PSV, that is pressure support ventilation, it sometimes used with SIMV, so that's why it is known as combination of mode. We see one by one here. There is first, that is CMV, continuous mandatory volume ventilation. Okay, so it is a completely provided by mechanical ventilation. Okay, in this mode the ventilation is provided to the patient is completely through the mechanical ventilator. Okay, in this type of mode patient cannot do any function itself. Okay, all functions of breathing, all functions of mechanical ventilation is done by only machine. So in this mode, the preset tidal volume, preset respiratory rate and preset oxygen concentration is present. Client cannot breathe spontaneously. Okay, I tell previously in this type of mode patient cannot breathe initiate, patient cannot breathe spontaneously. The all thing, the tidal volume, the respiratory rate, the oxygen concentration is provided by machine only. So client cannot initiate breathe, client cannot breathe spontaneously. The indication means in which condition the CMV mode is generally used. So paralysis of respiratory muscle patients. Okay, in क्या है? So in paralysis of respiratory muscle patients, okay, those patient who has completely paralysis of respiratory muscles. Okay, so that patient cannot initiate breathe itself. Okay, so that patient is require a ventilation which is provided by completely through machine. Okay, so it is an indication that paralysis of respiratory muscle patient need a mechanical ventilation, and in that a CMV mode is useful. Second is crushed chest injury patient, and crushed chest injury patient, that means कि in crushed chest injury there are damage of lungs and hearts also, so that's why lungs cannot function properly. In those patient the CMV mode is also useful. And in unconscious patient, generally in unconscious patient, that means if patient is in the coma stage or patient had a severe head injury, okay, or TBI, that means ke traumatic brain injury. Okay, so in that patient the CMV mode is useful. Next, which are the disadvantage of this mode? So that is asynchrony. Generally synchrony, that means કે together સાથે. Okay, and synchrony, તો that means કે કોઈ પણ મશીન છે કે કોઈ પણ ઓબ્જેક્ટ છે એ બીજા ઓબ્જેક્ટ સાથે કન્ટિન્યુઅસ એની સાથે વર્ક કરે. બટ asynchrony, that means કે in CMV mode the machine cannot synchronize with patient's ventilation. Okay, if patients can start a spontaneous breathing, so machine cannot synchronize with patient's tidal volume. Okay, machine itself generate its own tidal volume, and it cannot compare, or it cannot synchronize with patient tidal volume. So sometime in this type of mode, the hyperventilation is also occur. So disadvantage is asynchrony. Second is muscle of respiration become weak due to complete dependency on the machine. The respiration or muscles get become weak, making winning more difficult in patients. Okay, if we want patient from for winning, okay, so we cannot teach a patient to own respiration, because the all ventilation is provided by only machine, so it is difficult to take a patient towards winning. Total dependency on ventilator. Here the graph is shown in that peak pressure is shown. First of all, here airway pressure, that is positive, and here negative. Now in this type of mode, there is no any spontaneous breathing is shown in graph. Here no any spontaneous breathing, here no any spontaneous breathing, only mechanical breath is shown in the graph. Okay, so it's a mechanical breath that provided by a CMV mode, no any spontaneous respiratory effort by the patient. Okay, so graph is airway pressure versus time. In this, mechanical breath is only shown, no any spontaneous effort done by the patient. So this is a graph of CMV mode. Next mode we talk about, that is AC mode. Here we talk about second mode, that is AC control mode. It's same like CMV mode, but in this different is patient can initiate a breath. Okay, patient just initiate a breath, and then machine can preset a tidal volume and preset the its rate, and then it provide to the patient. Okay, so assist control, that means it's assist to a patient. Okay, assist control mode, the ventilator provide to patient with preset tidal volume and preset rate. Breathe itself, but ventilator assists by delivering a specific amount of tidal volume to the patient. Okay, I previously told you in that patient just initiate breathe, and then machine is provided a specific amount of tidal volume to the patient. Patient can initiate breathe and that are delivered at preset tidal volume. So advantage of this, decrease patient WOB. Okay, here WOB, that means work of breathing. Okay, so decrease patient work of breathing. It prevent disuse atrophy of diaphragmatic muscles. That means in CMV, okay, generally atrophy is occur, but in AC control mode, there is no disuse atrophy of diaphragmatic muscle, because patient also initiate breath. So that means muscle activity is done. So that's why it prevent a disuse atrophy of diaphragmatic muscle. Next, we talk about the disadvantage of this assist control mode, that is asynchrony. Okay, in this also asynchrony is shown present, because the patient just initiate breathe. After that, machine provide tidal volume. So asynchrony with patients breathing, then development of high intrinsic PEEP in obstructed patient. Okay, so due to the continuous tidal volume, preserved tidal volume provided to patient, so sometimes it is obstructed to a patient, so develop the high intrinsic PEEP, that means positive and expiratory pressure is generated in the patients, and in obstructed patient generally it is shown. Increase mean airway pressure cause hemodynamic disturbance. Mean airway pressure generally increase. Okay, so that's why hemodynamic disturbances is present. So hemodynamics, that means what? Generally the normal physiological parameters deviation is occurs. Okay, so that's why we have to measure hemodynamic disturbances, because that affect a blood flow. Which factor affect on blood flow, that is study in the hemodynamic condition. So in AC control mode, hemodynamic disturbances is occur. That means is some factors, that is mean airway pressure, which affect the blood flow of the body. So it's a disadvantage. Here in this graph, the initiate breathing of the patient is shown, and then the ventilation is provided by only machine. Okay, so it's a graph pressure and time, and here volume versus time. So in a tidal breath is shown by patient, then tidal volume provided by a machine. So it's assisting breath, or we can say it just initiation of breath by patient, and then it's controlled by a mechanical ventilation or assist control mode. Next, third, that is IMV mode. Third number, first we see CMV mode, second is AC mode, and third is IMV mode. IMV, that means intermittent mandatory ventilation mode. Mandatory, that means control. So intermittent mandatory ventilation mode. Spontaneous breathe plus preset tidal volume plus preset interval provided by ventilator. Intermittent, that means some interval provided by ventilation. First of all, patient can spontaneous breathe. Okay, if patient want to breathe, patient can breathe spontaneously. Then machine can set tidal volume that provided through machine into a patient's lung. Then preset interval provided by ventilation. So this three combination is generally present in IMV mode. Ventilator delivers a preset number of time cycle. Mandatory breathe, that means control breathe. Okay, patient also can breathe, and the machine also provide a specific amount of preset tidal volume, and it is mandatory, that means it is controllable and allows to a patient to breathe spontaneously at any tidal volume in between. Patient can also do a spontaneous breathing in between. Okay, in between mechanical ventilation tidal volume. So the machine itself synchronize the patient tidal volume and ventilated tidal volume, and then the specific amount of breath can deliver to a patient. So that's why it is known as mandatory ventilation, that means intermittent mandatory ventilation. Advantage, lesser V by Q mismatch. V by Q, that means perfusion ratio. Okay, here V by Q that show a perfusion ratio. So generally, okay, at the middle of lung it is approximately 1 and point 2, point 3, point 3 to 2.1. Okay, into the uh, base to apex of the lung. Generally at the middle of the lung it is approximately 1 V by Q ratio, and zero point 0.3 to 2.1 base to apex. So in this mode, the lesser V by Q mismatch. Okay, so it's an advantage. The lesser hemodynamic disturbances in AC control mode, hemodynamic disturbances is more because the asynchron is present in that mode. But here the IMV mode is synchronized with the patient's spontaneous breath also, so there is less chance of hemodynamic disturbance. Disadvantage, causing barotrauma due to breath stacking, lung volume and pressure increase. હવે in this mode, barotrauma, that means कि due to continuous air pressure that there is any trauma occur into the lungs. So because lung volume and pressure is increased spontaneously or continuously, breath stacking occurs. That means continuous manner the pressure is delivered by a ventilator. So that's why air pressure is increased and lung volume also increased. So that causes a barotrauma. The graph is tidal volume. Okay, patient just start breathing. Okay, and then machine is assist preset tidal volume to a patient, that is ventilator tidal volume is shown. So here this is by a mechanical ventilator IMV, and here the patient's spontaneous breath. So in AC mode, what is different? Patient just initiate breath and then ventilation provide all breath. But in this spontaneously, breathing is also continuous with machine ventilation. So it's a benefit of intermittent mandatory ventilation. Fourth number, that is SIMV mode, synchronized intermittent mandatory ventilation. સાથે okay, or together, intermittent interval mandatory ventilation, control ventilation. Generally this mode is very helpful and it is sometimes used with PSV, pressure support ventilation. SIMV plus CSV, that is known as combination of mode. So here ventilator deliver either assisted breath to patient at beginning of spontaneous breath or time trigger mandatory breath. Okay, that means ke in SIME mode patient breathes spontaneously and it is continued by patient also, but sometimes needed a mandatory breath also, so that is provided by a SIMV mode. Ventilatory support to patient, partial breath, that means कि half breathing is done by a patient and half is done by the SIMV mode. So it provides partial breath ventilatory support to patient, mostly used in COPD, that is chronic obstructive pulmonary disease patient and pulmonary edema patient. Advantage of this SIMV mode is it facilitate a winning because it mode, okay, it's a only mode that not depend completely on the patient, or the patient cannot completely depend on the mode. So that's why mode is allow a patient to initiate or to a spontaneous breathing in between the ventilation, so it's facilitate a winning procedure. Second is maintenance of muscle of respiratory strength. Okay, that means if patient also do a breathing and machine also provide a ventilation, so the strength of the muscle is maintained. So it's advantage maintenance of muscles of respiratory strength. Avoid atrophy of respiratory muscle. Okay, because in AC mode or CMV mode disuse atrophy of muscle is seen, but here the patient can also uh, do a try. Okay, patient can also do a spontaneous breathing, so that's why disuse atrophy is not present in this type of mode. So avoid atrophy of respiratory muscle. Fourth, decrease mean airway pressure and reduce ventilator and perfusion mismatch. Disadvantage, desire to wean too rapidly result in high work of spontaneous breath. Okay, if you want કે પેશન્ટને આપણે વિનિંગ પર લઈ જવું છે તો આપણની ડિઝાયર વિનિંગ પ્રત્યે બહુ જ હોય. ઓકે, પેશન્ટને હવે મિકેનિકલ વેન્ટિલેટર થ્રુ વેન્ટિલેશન કરવું નથી, પેશન્ટ કેન want a ventilation itself. So desire to wean too rapidly, that result in high work of spontaneous breath and muscle get fatigue. Okay, the spontaneous breathing is more than that mechanical ventilation provide. Okay, so that's why the muscle get fatigue due to continuous breathing. Okay, for the desirement of the going toward weaning, so that's why muscle get fatigue and weaning failure is happen. So it's a disadvantage here in this graph. A patient, okay, patient can start a ventilation then do ventilation again, but here at mode the patient need a mechanical ventilation. So SIMV mode is synchronized with patient's ventilation and provide specific amount of tidal volume or the respiratory rate and do a ventilation, then again patient start ventilation, again patient start ventilation, again patient need a synchronize. Okay, synchrony. So that's why SIMV mode is synchronized with patient and provide a mechanical breath. So it is a spontaneous ventilation plus mechanical breath. So that's why it is known as the SIMV mode, synchronized intermittent mandatory ventilation. Okay, so it's a graph. So here we complete all the mode. Okay, next invasive pressure mode we see into the next part 3. Thank you. So here I just revised what we see. So we start with invasive ventilator in that volume mode and pressure mode too. Pressure mode we see in the next part. Here we see just a volume mode, that is CMV, AC, IMV and SIMV. So first we see CMV, that is continuous mandatory volume. Then indication, disadvantage, advantage, graph. Okay, AC control mode, that is assist control mode. Okay, in that patient is just initiate a breathe, and then after the mechanical breath is provided by a AC control mode. So in this graph we show the patient can initiate a breath, and then assist breath is provided by a machine. Then third is intermittent mandatory ventilation mode. In that patient can spontaneously breathe. Okay, patient can spontaneously breathe, and then machine is provided specific amount of tidal volume to a patient. SIMV mode, that is synchronized intermittent mandatory ventilation. It is generally used with PSV also, that is pressure support ventilation. It is known as combination of mode, and it is very useful in weaning of patient. And here the spontaneous ventilation done by patient, and it is a ventilation done by a SIMV mode. So thank you.